And good afternoon. I'd like to call to order the Cabarrus County Board of Commissioners Budget Workshop for Tuesday, May the 29th. And today we have a number of groups again to present to us. And we are happy to welcome the Arts Council. And Noel Scott's with us. And you've got some board members too, I presume. Another one hiding in the back. So anybody that wants to come up, you're welcome. You can pull another chair up. We don't want to leave anybody out. Make sure we can get everybody up here. We're happy to welcome you here today to talk about your budget and the role that the county plays with your budget. So.
Thank you so much. Thank you for allowing me to present the Cabarrus Arts Council's request for funding for fiscal year 12-13. As you see, there are several board members here in support of our request and also grateful for your support over the years. Cabarrus County and the Cabarrus Arts Council have enjoyed a long and successful partnership. In 1982, the county commissioners appointed the Arts Council to serve as its county partner to apply for and receive grassroots funding from the state legislature in order to support the arts across the county. We have served the county in this capacity ever since. In 2005, the commissioners invited the Arts Council to move into the historic courthouse building. The county had previously renovated the building 3 years before, and they wanted it to be used and open to the public. The Arts Council then raised $405,000 for building improvements to create art galleries on the first floor with museum-quality track lighting, a state-of-the-art theater in the former courtroom, and a green room, dressing rooms, and office space in the former attic. In 2007, the galleries opened and the Arts Council coordinated the first downtown art walk, turning restaurants and stores into galleries, and it was an immediate hit. Next. In 2008, the Davis Theater had its grand opening, featuring 2 packed houses for 100 years of Broadway. In 2008, Arts Council staff discovered leaks from the roof and reported it to General Services, who worked diligently to catch the water until the roof was repaired. No substantial damage occurred because of the early discovery. Another board member just walked in to support us. The county continues to receive an excellent return on investment with the Arts Council. As an economic catalyst, the formerly closed and mostly empty historic courthouse now has visitors, tourists, meetings, art exhibitions, and performances with lively activity 6 days a week on all 3 floors. Over 9,000 people visited the courthouse in 2010-2011. 4 art walks attract over 5,000 visitors who fill downtown restaurants and purchase items at every store. 12 Davis Theater performances usually fill the theater to capacity and always fill downtown restaurants with audience members. 11 Modern Film Fest screenings in the Davis attract intimate audiences to downtown Concord. The Arts Council serves as an integral resource for the entire county. Over 30,000 students and teachers see professional performances annually through the Arts Council's Students Take Part in the Arts program. Okay. In 2010-11, the Arts Council distributed $22,910 in grassroots grants and augmented the state funding with additional grants for a grand total of $43,000. Arts Council programs and grants reached over 300,000 participants in 2010-2011. The Kannapolis Concert Series, Hospice Interlude Choir, Logan Daycare Music Program, the Multicultural Student Union Dance Team, as well as arts organizations across the county received grants from the Cabarrus Arts Council. Since 2000, the county has supported the Arts Council with $26,000. Our request for 2012-2013 is the same amount. Since moving into the historic courthouse building, our programs have increased tremendously and the community has enthusiastically participated. Our budget and staff have increased in relation to our expanded programs. We thank you for your partnership with the Arts Council. Without the use of the historic courthouse, we would not have professional performances, magnificent art exhibitions, or attract the visitors, restaurant goers, and shoppers to the community. And without your financial support, we would not be able to support the cost of these programs.
Okay. Commissioners, do you have any questions concerning the Art Council?
I just have a few general questions. You said you have 4 art walks a year, is that correct?
We do.
And 12 performances in the Davis Theater, is that?
Well, let me see that again. 11 Modern Film Fest screenings, as well as 12 performances.
Okay, great. I know I've been to a few of them, and it's
Yeah.
very nice. So, can you tell me a little bit more about the students take part in the
In the
art
arts?
program? Yeah.
We started that back in 2001. We first were going to serve 4th, 5th, and 6th graders. I worked really closely with the North Carolina Arts Council and both school systems to set it up. We choose we actually see the performances before we hire them. They all are curriculum related. K1, we usually bring something that's just going to get them used to seeing professional performances and learn how it is in front of live performers. Then grades 3 through 5, we do 3-4, 2-3, and 3-4 is the way we divide it up. And our goal in elementary years is to make sure that they see dance, that they see theater, that they see comedy, that they have music, so they see kind of all of the mediums. And then once they get to junior high school, we take them to each junior high school, middle school, and we usually concentrate on self-esteem, on their history projects, anything that we have a poetry. One of the people that you saw up there is a wonderful poetry performer. Then once they get to high school, we bring Shakespeare or history. And this is all done in conjunction with, we meet with the principals once a year, we meet with the superintendents, and we meet with the lead teachers of each area. And it's a huge program, one of the biggest in the state.
Okay, that sounds great. Now, do
Yeah.
all the schools in Cabarrus County participate?
Every school in Cabarrus County
Wow,
and
great.
Kannapolis, every public school
Yeah.
in Cabarrus County and Kannapolis participate. Every single child, K through middle school, sees one, and then in high school, they choose which students
Okay,
go to see the performances.
great. Thank you.
Thank you.
Any other questions or comments? Just a couple things more for, I think we all know the answers, but you do use space in the old courthouse, correct?
Right.
That's where you're located, is the old courthouse. And you get that, you don't pay rent on that, that's an in-kind contribution.
We do. We pay $1.
You pay $1 rent, okay, that's fine. $1 and other considerations, as we like to say. Okay, utilities, the county covers utilities?
That's correct.
Okay. And of course, if, like you mentioned, if there's any maintenance issues, the county covers, because that's a county building.
That's
So
right.
the
it
county
is a county
covers
building.
the, any repairs or anything needs to be done to the building.
That's correct.
So if someone in the community said, well, you're only giving Cabarrus Arts Council $26,000, that's why I was pointing out that there are some other things that you get that are in kind that we provide, because we do feel like the arts are important.
Absolutely. Yeah.
For the $26,000 that you actually get, as far as cash goes, what specifically do those funds go towards?
It really helps undergird everything, Liz. It's what we do is the way we raise money is we look at how our entire program works together. I would say specifically with that, I mean, when we first started it, when the $26,000 was first awarded, it was to hire me to help pay for a staff member, and the North Carolina Arts Council paid another part of the salary to get this Arts Council up and running. Once we moved into the historic courthouse building, our programs have exploded, both what we have downtown and what we do across the community. So it's a really integral part to what we do, and honestly, without being in the historic courthouse, we could not put on most of what we do. So it's a wonderful partnership. And we also just, I think you know this, but in our lease agreement, when we raised the $400,000 for the upgrades, you know, if we ever move out, that's the county's, you know.
And I do know that, but I
Thank
want to make
you.
sure, we are, by the way, I didn't tell you this, we are live on Channel 22 for our budget meeting, so sometimes we ask questions that, like I said, we know the answers to, but I want to make sure people in the community understand, you know, the partnership that's there with the Arts Council.
And I think one of the main things is because the North Carolina Arts Council came to the county back in the early 80s, late 70s, and it's been a very important partnership ever since then. The Arts Council wouldn't exist without the county's support. Thank you.
Was anything mentioned about the events that are brought, the Davis Theater, the movies that are on Friday nights after art walks? Was that mentioned earlier? Because I was not here earlier.
It was, but you're
Okay.
welcome to say some more about it, Mr. White.
Well, I mean, I think that tagging off of what Madam Chair said is that there are some indirect benefits that the Arts Council receives, but also with the art walk, with the Davis Theater, with a lot of the activity that y'all generate in downtown Concord, that ends up being sales dollars and tax dollars that we in turn get as well. So that I think that is very important for us to recognize is, yes, they don't have rent, they don't have utilities, but we're getting tax dollars through their efforts to generate business down here. And I know that the restaurants are very full and packed, at least on the Davis Theater nights. So.
And the merchants, we visit the stores and the restaurants on a regular basis, and they are all, from the very first art walk, have been just thrilled with what we have been doing, because the audience members actually not only go and eat at the restaurants, but they go in and purchase items at the stores, and that's not the case with every single thing that happens downtown.
One
So it's
thing
been
that I
good.
don't know if it's a direct involvement, but I certainly think that there is a connection or connecting the dots, is the seventh grade. I think it's just seventh grade. It might have been seventh and eighth grade. The county system had a fair project, a math fair project, and the top 25 students or projects were presented, and there were, I bet you, at least 5 that involved mathematics and the arts. One was mathematics and how mathematics is used to define good artwork as to the symmetry. And this is a 7th grader writing an article about it. One was mathematics as it relates to, what was the other? Of music, and how the importance of mathematics in music. So I think that I doubt very seriously that they would have not had some sort of idea to do that if it was not for the arts coming into the school system. So I think indirectly it's amazing what the kids are picking up.
One other thing, if I may, is that okay, mention is that I did not mention is that our galleries are used regularly now by the school system, because it's free for them to bring in their students, and we have tours. They can talk with the curators. Some of the teachers now bring them in for every single exhibition, and it's a wonderful part of their education.
And I think we all agree. Any other questions or comments? Before you get up, though, will you go ahead and identify your board members that are here with you, since they were kind enough to come out?
Introduce yourselves, please. Ruth, would you start?
Yes, my name is Ruth Brooks, and I'm with the Multicultural Student Union, and the Arts Council has really been great for my kids. We come into the during the summer months, and it's been wonderful.
I'm Brenda Trott, and I'm a former educator, and moved away but came back to the Cabarrus County and saw the importance of arts in our education. So I'm a real supporter of the students take part in the arts, and would like to invite any of you to come on the days that we are there giving those performances and seeing those children. It is just amazing. And so that's my call to this board, is to be sure we keep that going. That's so important.
Chris Shoemaker with Ben Minot, Family of Dealerships.
Dan Boone, local attorney, and I am vice chair of the board, which means I'll be chairman one day, I hope.
I'm Charles Farrar, member of the board, and have been in Concord now for about 6 years, and spent some 25 years in Charlotte on the opera board and the symphony board. And I'll tell you, the bang for the buck here in Concord is huge with this particular board. Okay?
And a wood turner.
And I'm a woodturner. I'm a practicing artist, yes.
Well, we appreciate you all coming out this afternoon and presenting your budget request.
One thing, Madam Chair,
Yes.
that he's too humble to mention it, but Charles has pieces that are in the White House. And they're on display throughout the world for a lot of different places. So Charles is not just a wood turner. He is a word artisan. And I would certainly offer anybody the opportunity, if they have not seen artwork, they need to see his artwork as well as many others. Thank you.
Thank you all very much.
Thank you so
Thank
much.
you.
Okay, next we've got community care plan. Cindy? And anyone that you, how many people you have with you, all of you, welcome to join. Thank you so much for coming this afternoon.
Thank you very much for giving us the opportunity. Boy, you guys have a difficult job, I can see that. My name is James Cook. I'm the medical director for Community Care of the Southern Piedmont. And again, I do appreciate the opportunity to be able to speak with you. Our organization is one that like you folks, tries to be a good steward of the monies that are entrusted to us. We're in the medical field, obviously, and while we try to ensure that people get good quality care at the grassroots level, we also try to do it very cost effectively and not waste money. Our state organization, Community Care of North Carolina, has saved the state millions and millions of dollars over the years in Medicaid funds in particular. In fact, CCNC is recognized nationally as a pioneering leader in a lot of the programs that they run. People come from other states to see how they do things with our different networks. We're one of the 14 networks in this county. What I want to talk to you about today, though, is one of our smaller programs. It's called the Community Care Plan. This effectively functions as a safety net organization for some uninsured indigent. You have a sheet that has several bullet points on it, and I would like to use that. I'm not going to cover each and every one of them, but I have several I'd like to highlight and just tell you a little bit about the program. Each of our, and I'm going to jump around a little there, I'm going to use them in a different order. Each of the uninsured enrollees is assigned to a medical home, but note that they can be terminated if they don't follow the treatment plan. In other words, we're not interested in helping people that don't want to help themselves. If they're not going to work with the physician, follow a treatment plan, be compliant, then we don't want to waste our money there. So we want patients that are responsible, take some responsibility for their own health care. Secondly, CMC Northeast and Cabarrus County providers have taken note of this and have agreed to donate their care to this patient population. Thirdly, this program basically supplies medications, is its niche, through the Community Free Clinic and Walmart. And for 12 years now, the county, with the help, or in addition to the Health Net grant, has provided funds for this program. $50,000 annually is what the county has done. This makes this the second longest program of its kind in the state. Over $12 million worth of services in the the full year from June 2010 to 2011 has been donated, which is about a 35-to-1 return on investment. We do screen applicants for other payer sources, such as Medicaid, workers' compensation, that sort of thing. And in fact, in the last 16 months alone, we have discovered 143 of these folks that actually met Medicaid eligibility. So in essence, this is a last resort program for many who have no other place to turn. I will say that most of these people are employed. Some are not. Some have lost their jobs during the recession. And as a health care provider, I can tell you that when our health care providers in the county are donating their services, it's a great value to know that the patients are going to be able to get their medications and follow through with the recommended treatment. You may recall during the Republican campaign that Mitt Romney was roundly criticized when he said he didn't worry about the poor. Of course, like a lot of the things that happen in the press, that was taken totally out of context. And what he was really trying to say is he didn't worry so much about the poorest of the poor because they had some safety nets, such as Medicaid. But the lower middle class, uninsured type people were the people he worried about, and this is just the kind of niche that these people find themselves in. As a citizen, taxpayer, and healthcare provider in this county for over 30 years, I'm proud to say that we have seen fit for the last 12 years to help this group of underserved people, and just hope that you can find the funds to do it for another year. Cindy Oakes is our executive director, and I think she might have a point or two she wants to make, and certainly she knows more about the nuts and bolts of things if you have those kinds of questions.
Again, thank you for allowing us to speak to you today, and our request would be that just for one more year that you provide us the $50,000. A year and a half from now, we anticipate healthcare reform, and there will be not as large a need as it is now for a program such as ours. So if we could have that $50,000, that would help us to provide care for these people until the time of healthcare reform. We would greatly appreciate it, because as Dr. Cook said, we would hate for a program that has been a leader in the state, one of the first in the state that has a community program such as this, to have less availability to provide services to people in this last year.
Commissioners, questions?
Yeah. First, I'd like to ask, is there any other contributions that's coming into your organization? I know you spoke of some in-kind contributions.
We receive $190,000 a year from a HealthNet grant that the legislature has provided to counties such as ours that it can apply for.
Okay.
We continue to receive that. The providers and hospital donate the services, which is the $12 million in donated care.
Okay, so will you be eligible for the state grant that you were just speaking about for this?
Yes.
Okay.
We remained eligible for that grant, but that pays for our staff when we have to pay for the medications. That
Okay.
is what is difficult for us to do with just that money.
Okay, and then you spoke of being enrolled in a medical home. What does that entail? A medical home?
Basically, what that it's really the traditional model, except that it's stressed in these programs, and that by traditional model I mean a primary care office who is in charge of your care to where you're supposed to go first, except in the case of a true emergency, instead of showing up in the emergency room for something that truly is not an emergency and overburdening that system. That way, your primary care provider also knows, where you're going, what your medications are. There aren't so many different providers involved in it, and it's very cost effective.
Okay. And so what are your hours of operation?
Well, our hours of operation for the organization are 8 to 5, Monday through Friday, essentially, but the hours of operation for our patients are, the hours that the primary care offices are open.
Okay.
And they all have 24/7 coverage, either by telephone
For their own call.
or their own
responsibilities.
call.
How many patients or clients do y'all have?
Currently, we have about 1,100 patients. We average between 1,100 and 1,200 patients a month.
And how much dollars does CMC Northeast provide to y'all?
They
Dollars.
provide services in the in-kind.
Okay. Do they give you any money?
No.
Okay. And when you say in-kind, what does CMC give? Not the medical doctors, what does CMC provide?
Whatever the primary care prescribes that the patient may need, x-rays, CAT scans, surgery. We've had people that's had hip and knee replacements because that's going to get that person back to work. Can't think of, but whatever, lab work.
Okay.
any
Now,
of the services that's available. We do not cover cosmetic surgeries or surgeries that are not necessary, but they provide any necessary care.
when you're talking about getting people back to work, is that part of workers' compensation?
No, we look for workers' compensation, but sometimes people may not be working and they've had arthritis so bad that they can't walk or they can't work in their hip or their knee. I know that we have they have provided several surgeries of that type.
Okay, and that is in the past 12 months?
Yes.
Okay. In regards to, so that the $50,000 you're asking from us is to cover medicines, the purchase of medicines.
Yes.
And the $50,000 you would pay Community Free Clinic to purchase these medicines, and then they dispense them, or how does it work?
We use the Community Free Clinic and Walmart. We use the $4 formulary, and we pay Walmart for medications that they use because that's the least expensive way to do that. We may not be able to, with this funding, to provide all the meds through the free clinic, so we may have to use MedAssist as a program that provides them free meds and mail them to their home.
Okay. And how is community care of Southern Piedmont different than the Health Alliance in regards to treatment and clinical services?
We do not provide any hands-on treatment. With the Medicaid patients, we provide care coordination, helping the patients learn more about the disease so that they can take care of themselves, educating them not to go to the emergency room. We do the same thing with the community care plan patients. We're assigning them, when they get approved for eligibility, we assign them that primary care provider, help them get to their appointments. If they have questions, if a primary care physician wants to make a referral to a specialist, we make sure that that specialty care is needed and then make that appointment for them.
So Community Care Southern Piedmont is the same as the community care, Cabarrus Community Care, I don't know what the...
We used our, Cabarrus Community Care Plan was our name until a couple years ago. We changed it to Community Care of Southern Piedmont at the request of our statewide organization that provides care to the Medicaid patients. All 14 networks are going to the name of Community Care of whatever is their region.
No, what
sorry.
there's another community care, I thought, program on McGill.
That's Cabarrus Community Health Centers.
Excuse me, the health centers. Is that different than, how are they different than Community Care of Southern Piedmont?
They're one of our medical homes. They provide actual care to the patients.
Okay, so basically you are the conduit for people for medical treatment.
Yes, sir.
We are, I guess you could say, essentially a case management
Right, I'm trying to figure out
organization.
what separates y'all from the Department of Social Services, the Health Alliance, some of these other organizations that we already fund. That's what I'm trying to figure out. Is that if it's a case management, isn't that similar to what some of the things the Department of Social Services does, and the same thing that does that? I'm trying to figure out what sets y'all apart than some of these other agencies, number one, and then also, isn't this what the Northeast Medical Center should be doing anyway?
I guess what sets us apart is after our patients have been declared eligible, we have nurse care managers that work with the patients to educate them about their disease, to help coordinate their care, to provide, to help them learn to take care of themselves.
Okay.
I'm not sure exactly what social services does directly medically, so I can't answer that part of it. But
And they may not do anything. I'm just, I may be incorrect in that assumption.
right. What I was going to say, though, is that in addition to helping manage those cases and trying to get the people to their appointments and being sure that they are not letting their meds run out and all of those sorts of things, we do try to see that our practices follow what we call evidence-based medicine, or doing things that have been shown to be of value, and we try to keep those providers educated and provide them with data about how well they're doing following those measures and their scores and so forth.
let me try and get around what my point I'm trying to make is, it seems like Carolina's healthcare system, as large as they are, relies on a lot of other people to do non-revenue producing work for them. And that may not be a fair assumption, but it seems like y'all are being very generous in being case managers for people that are having a difficult time understanding what care they need. And what I'm trying to figure out is, why isn't the hospital providing that when that is one of the things they're supposed to be doing? And y'all may not have that answer, but that's what I'm trying to figure out.
Well, the only thing that I would say is the traditional role of the hospital and viewpoint has been focused on inpatient medicine, and mostly what we do is outpatient.
And I agree. They've started buying up doctors' practices, so now they're into not only in-care medicine, but also that kind of medicine as well. So they have put themselves out there.
Point well taken.
It's just that the tough thing is, y'all are doing a great service. It's just a non-revenue producer for the hospital, if they were to do it if they were to take on that responsibility as well. Okay, thank you.
How do you receive your clients, or how do you solicit clients? Is there a referral program, or how does that work? Do they approach you?
There's a referral program, and Department of Social Services assesses their eligibility using Medicaid guidelines.
Okay. And so in one of your slides, it says in the last 16 months, we've identified 143 patients as being eligible for Medicaid. So is that after they come to you? Why would they be referred from DSS if they're already eligible?
Because when they go to apply for CCP, they may not have ever went to DSS to apply for Medicaid before, so they found out they were eligible. Sometimes patients are close to being eligible for Medicaid, but they have not had enough hospital medical bills, so when they're under our program, DSS can monitor them more closely to see when they reach that point that they've had enough bills that they could be eligible for Medicaid.
Okay. And do you have a system in place, if someone comes in and, they're below the 125% of the federal poverty line, how do you really check the information that they give you? Is there a way to be certain that, their application is truthful, or the information they provide is accurate?
DSS uses the same screening tools they do for Medicaid.
Okay.
And we do a reassessment every 6 months to make sure that the patients remain eligible, because that's one thing that the physician, the medical community have felt comfortable with, that when they are being assessed, they really are at that poverty level, since they're being assessed by Department of Social Services.
Okay, thank you.
Mm-hmm.
Do y'all receive any help from the drug manufacturers with prescription drugs?
No.
Not any?
Well, the Community Free Clinic does do some fill out patient assistance forms to get medications.
Well, you mentioned a while ago, if somebody comes in and don't want to take the treatment like y'all prescribe it, that y'all no longer work with them, where do those people go when y'all turn somebody out? DSS?
They may go to DSS, they may go to another provider where they have to pay, or they may not receive care.
Well, if they don't have no money to start with, they can't go to somebody where they have to pay.
And do you operate out of, if I'm looking correctly, McGill, at their center, the McGill Center?
We are at 845 Church Street North.
Okay. Yeah, I thought I saw somewhere, do you get patients that might come to either the Logan Center or McGill?
Yes.
And they get referred to you from those two entities?
Yes,
Is
they
that
can.
one of the ways that you get patients?
We get patients that just know about community care plan, or that go to DSS for other things, get referred. Physicians refer their patients to us.
Okay. And the $50,000 that you're requesting, that's only going to be used to pay the $4 copay at Walmart, or is it going to be used for anything else?
It
I just
would
want to make
be-
sure I understand what that money would.
It would be used for medications, whether it's at Walmart or the free clinic.
Okay, so you have to pay
The
at
free clinic to
also.
do some of the medication assistance forms, yes.
Okay. That's what I wanted to make sure of, where that $50,000 is not going to pay somebody's salary.
No.
Okay. And do you have any other sources for funding, whether it's, we call it fund balance, savings that you have that might cover this for the next year and a half you mentioned?
No.
Okay. Any other questions? Do you want to?
Yeah. As far as in the proposed budget, it was my understanding that we had contributed for several years 100,000 and then dropped the last 2 years to 50 with the intentions of it no longer funding it. So my recommended budget does not fund this program. And first, I guess, the initial letter we got, there was a $100,000 request, not 50,000.
Yes.
So it's changed now to 50.
Yes.
And I knew nothing about the 1-year extension or just for one more year. That was not brought to our attention either. So, and I am looking at fund balance statements here, and it appears that you do have quite a bit of fund balance in several of the programs. And then also,
Do you mean in several of our additional programs?
well, even in the community care program, it's not a huge one, but there is 76,000. Does that sound right? The one that I'm looking at.
That may have been at the change of the fiscal year. With HealthNet, we get money by the quarter, so it's not on our exact fiscal year.
And of the 3 counties that you guys operate, we're the only county that contributes money?
Our 3 counties, the funds that you see from our financial statement, that is for our CCNC, the Medicaid program. We're not allowed to use those funds for the indigent program. And we provide the case management, care management services for Cabarrus, Rowan, and Stanley County Medicaid patients. In Cabarrus is the only place that we have a community care plan for the indigent population.
What were the 3 counties again? I'm sorry, Cabarrus, Rowan, and
Stanley.
Okay, so the program that you want us to fund, you're not doing in Rowan or Stanley?
That's correct.
How do they handle it in Rowan and Stanley, do you know? Or is there a program even there?
There's not a program there.
Any other questions, Commissioners? Okay, well, we appreciate it.
Thank you.
Thank you.
Thank you very much for coming out. Next up, we have the Cabarrus Health Alliance. And we have Dr. Pilkington. I was going to say, I know I saw you here somewhere. And Mr. Phillips, of course. Welcome. We appreciate you guys coming out today. And we'll let you present your budget. I'll let you go.
Do they have the figures?
They do have the budget recommendations that they've made, I think. There.
Okay, I just wanted to be aware of what you were looking at. And the bottom line, as our best recall, was 4.6, is that correct?
This particular budget that we presented has the mandated services, it's 5.1 million.
Okay.
We'll do 4.6, though.
Beg your pardon?
Charles was asking for 4.6.
We'll take 4.6, yes.
All right, well, I hadn't seen this figure just yet. I was going by a few weeks old numbers. And we have a Medicaid cost settlement, which is in progress. Have we heard?
We have budgeted the Medicaid settlement that we get at the end of each year. It comes at the end of the fiscal year, and normally by now we know what we're going to get for the current year plus the next, and we have not heard yet. And it's a toss-up between $900,000 to $1.6 million. So it's quite a difference there, so it's been a little hard to determine what the needs are. So the projections that Mr. Phillips was talking about versus the one I submitted, some of that was trying to toy around with what we're going to get from the state.
And we tried to be conservative and come up with a reasonable amount that we would receive from them. But this budget reflects no increase in services, with the exception of adding a full-time environmental health specialist to help with the restaurant inspections, because we consider that to be a high priority item, as I believe you all do. If nothing else, that's one of the things the public is highly aware of in the field of public health is are the restaurants being inspected? And given our growth, we have so many restaurants, we're having a challenge keeping up. We felt like we needed to add that one position. And we did, Chairman Poole did request that we investigate the possibility of providing health benefits to the school nurses. And we pushed and pulled and shaked, and it would be about $300,000 in addition to this to provide that, because we are required to provide the benefit to all part-time employees in the organization. So while there are 42 school nurses, there'd be 56 employees, and that would be $300,000 for this budget year, and then would continue, the need would continue to increase. You guys know as well as we do what the increases are. We managed to get by with, I believe, 12.5%, 13%?
It's 13.1%.
13% increase, and we felt like we were doing really good, but that's an ongoing increase. And the other thing is that the last time we checked with the school nurses, there was only moderate interest in having a health benefit. And we are in the process of doing another survey to see what the actual interest is. And if it turns out to be high, we would certainly bring that back to you at the next budget cycle. But at this point, the last survey we did, which has been a year ago, over a year, the interest was pretty modest. And so it would be up to you. If you want to give us $300,000, we'd be happy to put it toward health insurance for them, but that is in addition to what you see here. But it was something that had been requested that we investigate, and that's what the bottom line for that would be. And it's your decision, but I would think with modest interest and a $300,000 cost, I would look at it hard.
Questions? No, we've talked about the Health Alliance budget before.
I got a question, discussing the insurance. How high is the turnover rate for school nurses, would you say?
It varies each year. This has been a higher than usual year. At 42 school nurses, we've already turned over 11 of them this year, so it's been an extraordinarily high year, but almost every one of those has been related to something other than a health insurance issue. We've had 2 that are health insurance related, because this is essentially a female population,
right,
and many of them relied on their husbands for their health insurance. So in these couple of cases, they lost their health insurance and they had to go do another job. But by and large, it rarely comes down to, as Mr. Phillips said, it being, I need health insurance to keep working. But it does affect 2 to 3 every year. I mean, that's pretty much an average of who leaves us each year because of health insurance.
Okay.
While we're on the subject of the school nurse program, I will say that this budget reflects a modest increase in wage to try and keep up with the market rate for nurses. Nurses are in high demand, and we have seen fit to increase their wage to retain the ones we have and hopefully to attract new ones as positions open up. So they will be getting more money in the coming year based on this budget. It's not a great deal, but we feel like it keeps us at the market rate.
In reading this, it seems as though the state is requiring us to provide environmental health and also inspections. And it's costing, with their generous supply of providing us with $4,700, it's costing us $615,000 to implement their wishes on us. Is that correct? Am I reading
That
this right?
they will not let us charge fees for.
Right.
I might add.
Okay. I just want to make certain I'm reading that right.
And not only that, all the rules and regulations are written by the state that we must enforce, which would fill up this room, which we have no input into as well.
Other questions? So the pay raise, is that only for nurses or is that for everybody?
That's a general pay raise across the board.
And is there a certain percentage that you're doing across the board, or what are you doing?
There's an average of about 3%, and it's for 7 months, because we usually award the increase December the 1st.
How much extra is that in your budget? You said? I know it's here, but there's a number of pages.
It would break down differently because it breaks down into the mandated services that you're talking about here and then the non-mandated services, so it would be spread across both of those. But as for mandated, these particular programs that Commissioner White just addressed, I don't know how much that would be. We'd have to sit down and calculate by employees in environmental health or CD and run that number, but it would be roughly about a fourth to a half of the raise would be in those mandated services.
I'd like to say 2 of the last 3 years, our employees have had no increase, so we're kind of playing catch-up here.
And it is important in the nursing field especially because we are competing. In the old days, we didn't compete with the hospital as much, but now, especially like with these school nurses, we compete directly with the hospital. So when you take out health insurance and other things, if you start not keeping up with the market rate for nurses, they also pay shift premiums, other incentives to work there. It'll be really hard for us to attract nurses. That's always been 31 years at it. Keeping up in the market rate for nurses has always been a problem. We always, and it used to be we're fighting with the Charlotte hospitals, but now since they're all the same, it's basically one market. So.
How much money does Carolina's Healthcare give y'all?
We get no money from Carolina's healthcare system.
How about CMC Northeast? How much money do they give you?
We get no money from them.
You talk about fees. Y'all can't charge a fee for any of the services y'all provide?
No, that's just for restaurant inspection.
Well, I'm talking about in the other things y'all do, though, like, say, delivering babies. Y'all can't charge fees for any of that?
We do charge a fee for that. In fact, we
Is it according to their income?
It is according to their income, and they have to demonstrate their eligibility with paycheck or some other form of proof of that. All these mandated services like communicable disease, things like, we're not allowed to charge a fee for.
You can't charge anything for that?
No, they're required statewide and every health. You can come from Brunswick County and get your services in Cabarrus, and we can't charge you a dime. That's what the state law reads. So we have to see all comers from all counties for communicable diseases.
Somebody set the rules up wrong, didn't they?
They sure did.
We just need to provide a bus service to another county.
Well, it's interesting, but what happens is that you see some of our adjoining counties who I will not point out directly, but they will set up and make it difficult to be seen for communicable disease services. So we'll see their people because if you come on the third Thursday after the first Tuesday, the fourth Monday, they'll see you. But that's unfortunately the way it works. And we provide our services 5 days a week, 8 hours a day. So.
We talked before when you came on your budget about the increase in utilities cost for your building and, of course, the rent that you're not paying that you were previously paying. So it's hard for me to break this budget down that you gave us, but can you talk a little bit about how you've accounted for those two, the increase in the utilities versus the rent?
Tammy can go into it in more detail. I think her and Pam have talked about this as well, and they've checked it with Kyle Bilfer from the county to see if we were on target with what we assessed as that. The one tricky one we don't know about yet that scares us a little is the water cost. And that's because we've been trying to keep grass alive, and it's hard to say this on a day like right now when it's hitting the rain is hitting the windows outside, but it's been a real dry month, so we've had to try to keep grass alive and spend a lot of money on water. We don't know what that will be yet, but hopefully that will be a temporary thing and not an ongoing thing. But we feel pretty good with what the county staff has recommended based on what we've sent them. Mike or Pam want to talk about that.
I guess that the recommendation in the manager's budget was to hold their funding flat, except for we took into account, we removed the rent and then added back the additional maintenance cost, building maintenance cost for the new facility, and that's what the net number is there that you see.
Okay. Pam, I had said something to you. For the school nurses, some of them are funded through Cabarrus County Schools and some are funded straight through the Health Alliance, and had made a suggestion that we take those out of the school system's budget and move it into the Health Alliance, so they're all, if they're their employees. Is that reflected, or is that something else that we would need to look at?
That is not reflected. We can make that final change. I do have that information of how much money is in the Health Alliance budget and where they're getting it from. As far as Cabarrus County Schools and Kannapolis City Schools, instead of giving the money to the schools and the schools turn around and giving it back to the Health Alliance, giving it directly to the Health Alliance, I do have those figures that we can make an adjustment for. There were 2 programs that Cabarrus County talked about that didn't seem to be direct, more of a billing for service, and it was for the Kids Plus. Is that a 1/12 allocation, or is that for when they provide services?
That's a per hour, per service.
Okay.
As they provide, yes, reimbursement.
Okay, so I would probably advise not to move that money, but just to go ahead to move the 1/12 allocation for the nurses, and that would be a little over $900,000, $950-ish. But we can take those and move those from the school's budget and just make a direct allocation to them. But I have those numbers here to do that if that's what you decide you want to do.
And just as a reminder, I know over the years, we've talked about this, but just to make sure everybody understands, we are funding some nurses through the school system, which turns around and sends the money to the Health Alliance, but they are all considered your employees, because in the event of an emergency, you're the ones that are going to call them out, not the school system. And so it seemed to me that it would make a lot more sense and be able to track it better and be more transparent if we just move their funding to you guys. Or is that okay with y'all, or do you have any thoughts about, instead of you getting it through the school system, you just get it direct from us?
I think that would be fine. The confusion that arises, since it's 3 different budgets sometimes, is that somewhere along the way between school board members and county commissioners, it's not understood what the program is. So it's kind of an education every year. So if we had it in one budget, I think you'd all have a lot less to go through each year to get this allocation out to us.
I mean, I think we've all said that or at least the majority of us have said that school nurses are important. I think you would agree that they're important. As far as you guys goes, I'm sure the schools would agree that they're very important for the school systems. I knew that we were funding them in 2 different ways just from my background, and was trying to, like you said, make it a little bit more, make it easier for everybody to kind of track and follow, so that we really could follow where that funding was going. So to me, it was logical to put the funding with you guys.
One of the things I'd like to state is the amount that we have projected from Cabarrus County Schools was based on the number of school days that's in the current year. I understand that the school year is going to be adding 5 more days next year, and the city of Kannapolis, or the Kannapolis City Schools, had told us that they would fund that additional 5 days per nurse, but we were understanding that the county was going to go with a waiver and not add those 5 days. Is that correct? Do you know what the outcome of that is?
If Cabarrus County Schools gets another waiver, I think it'll only be for the 1 year unless the legislation changes.
Okay.
That's the debate. The legislation changed very quickly, and there was a waiver this year, and I believe that they were asking for a waiver for next year, but I'm not certain if that, I don't think it's been granted yet.
Okay, because the revenue and the expense does not have the additional 5 days for the Cabarrus County school system.
Okay. Then what I would say is that we need to track that down and just make sure. And if that's, if the 5 days are going to be, do you understand what that means?
Yes, Tammy.
Does everybody understand? I'm sorry.
Right now, I had that conversation
students are
today.
in school 180, and the legislature said students should be in school 185. So it would add an extra week of employment for nurses to be on campus for those extra 5 days. So I would say that we need to verify the cost and make sure that they have funding to cover 185 days from both school systems. and that's the county responsibility to cover that extra week. We would amend our budget to cover those 5 days more for the nurses.
We would fund the additional 5 days
That's
for
what I would
Cabarrus
say.
County schools, but not for Kannapolis
I
City
would
schools.
do it for both school systems personally.
Because Kannapolis has actually budgeted those 5 days in the amount that they gave.
And I don't know what the amount is. I mean, you'd have to
It
tell me
was
what.
around $9,000 for Kannapolis.
For Kannapolis, yes.
Was additional-
9,000?
An additional 9,000 for Kannapolis.
Yeah.
Okay.
And I didn't compute for Cabarrus because they were pretty certain that it wasn't going to be, they weren't going to have the additional 5 days.
I think that we should fund, the county should fund those extra 5 days for both school systems and move those positions to the Health Alliance, all the nurses, school nursing positions to the Health Alliance, and that we should fund those. And then if Cabarrus County doesn't need those 5 days this year, then we can pull that back out if they need it. If they don't, if they get the waiver this year, next year they're not going to get the waiver unless the legislation changes. I mean, that's just, y'all can tell me what you think, but if that's a responsibility for us, I think that we should, it's not a huge amount of money that you're looking at.
Okay.
So do we also contribute money to the Kannapolis City school system for them to in turn pay school nurses as well, or is it just Cabarrus? So we should do it.
I think we should move them all.
I think it should all be the same.
Yeah, I mean, I think we should treat both systems the same. And I
It seems to
presume-
make excellent sense to me. I've always kind of wondered about, moving the money from one pile to another pile to another pile, but I'm delighted to see you doing that. I would like to ensure that we are aware that as the school system grows and schools are added on, that we will get increased funding for increased nurses. I mean, that's been, basically, that was coming through the school system budget, and I'd like to see that incorporated into consolidating it in the Health Alliance.
And I would agree with you that if we add schools, that the county should fund those school nursing positions also.
Wonderful.
And I think that would be part of funding. We're not going to increase schools in the next couple of years. We're not planning on adding any other schools, in the near future. But I agree with you that if we add additional facilities, if the county adds additional facilities by building a new school, then we should also understand that part of the cost of that school is providing for a school nurse.
Thank you.
So we will transfer the expenditures that we would have given to the schools for the 180 days, and then we will increase the county's budget by the 5 additional days, is what you're stating.
That's what I'm requesting now.
But also this city of Kannapolis.
Yeah, for both school
Okay,
systems.
both.
But we're going to pick up the additional expense for the extra 5 days. I just wanted to make sure I understand.
Comments,
We can't.
questions from anybody?
We can't.
I thought they wasn't gonna have them this year.
I think we should budget for them in the event they don't get a waiver. And if they get the waiver and Cabarrus County doesn't use the 5 days, then we wouldn't pay that money because it wouldn't be tied to their salaries. And then we would know, we would have identified an amount for next year. Based on the legislation, I think they get, I'm surprised if they can get a second year. Originally, the school systems were told, you get 1 year to ask for a waiver and you can't get a waiver the next year, so
What's the amount for Cabarrus County?
she didn't know yet. It's gonna be less than, if it's 9,000 for Kannapolis, I don't know how many
About
Yeah,
27,000, I think,
8 positions. in
for
Kannapolis.
Cabarrus,
for Cabarrus. About
So-
30, it's about 37 overall.
$36,000,
That's off the top of my head, by the way, real quick.
roughly. Somewhere under $40,000 to cover.
Well, the city of
Might be
Kannapolis is roughly about, without the extra 5 days, the city of Kannapolis schools would be about 146,000. Cabarrus is 793,000. So I'm thinking that number might be a little bigger for
I
those
think it's
5
bigger than
days.
that.
That's because Cabarrus County pays a larger percentage
That's
for the
true.
school
That's
nurses
true.
than the city of Kannapolis.
So they're not equitably
No.
paying either.
No, they are not.
That's true.
It's pretty far apart.
Okay, well, before we come up with the exact number, you've got a little bit of time to try to nail that number. Personally, I think that the concept of all the school nurses should be funded directly through the Health Alliance. And that if they're working 180 days, we pay 180 days. If they're working 185 days, we pay 185 days. And if we add additional schools down the road, then those schools deserve a school nurse just as much as the current schools. I'm going with the theory behind school nurses and saying that if it's an important issue for the commissioners, then we should fund it. And
Okay.
that's y'all's job to
Ms.
come up with the exact
Harkey and I
dollar
will
amount.
work on that, and we'll have something for you guys to look over of what the
Exact number is.
what it would be if it were 100% of the school nurses were being paid for.
I just think that makes sense. The other comment was on the insurance. The request that I had was to allow them to pay for it. And
And we cannot do that. We checked into that. The insurance, we talked to every company that bid on our Blue Cross Blue Shield, Aetna said that you cannot set aside a pool of employees and say they can buy in, but the other pool is provided by the employer. It's either one or the other.
I think it's called adverse selection. They assume that the people who decide to opt for the insurance would be the ones who would have the highest drain on the system. So to have a predictable risk pool, they want to have it be everybody or nobody.
that makes more sense to me.
Yeah.
That last part made more sense to me on it. I just know what I was asked
That's why he's here.
to try to see if there wasn't some way of doing it. The other thought was, school nurses are 10-month employees because of the school year. I'm considered full-time even though I'm employed for 10 months. So I have to make it up in, I guess, my May paycheck, they take out 3 months in order to cover for the 2 months during the summer when I don't get paid. So it seems to me if school systems can do things like that, that because of how they're being employed, that's why I would think that school nurses could be looked at differently. But I understand, I mean, I appreciate the fact that you checked into it and tried to, to figure out what could be done. I guess the only other idea at some point in time, if you ended up, I don't know, having something extra in the summer and you needed to bring on some additional nurses, I would hope that maybe some of the school nurses could get summer employment with you for those 2 months. If anything came up where you needed to hire somebody on a temporary basis for some reason, that you would consider those nurses to be the first ones that you offered summer employment to.
We do.
We do, and we also have one PTSO that does provide for their nurse to work additional hours with the PTSO's money.
I've got one more question before we move on. With the school nurse program, so Cabarrus County gives the money to the school system. They in turn give it back to the Health Alliance. The city of Kannapolis, we give their school system money for the program, and they in turn give it back to the Health Alliance. Now, does the city of Kannapolis kick in any money to their school system? Because you were saying something, there's a difference there.
The city of Kannapolis and the city of Concord do not participate for the school health nurses. But what I think Ms. Harkey was referring to is that Kannapolis City Schools doesn't fund 100% of the nurses in their schools. They pay for part of their salaries.
Okay. And so the Health Alliance picks up the additional cost?
Yes.
Okay.
Any other questions on the?
One of the things that's pretty large in the Health Alliance budget is clinical services. Is there an opportunity to transition clinical services out of the Health Alliance into another agency that is not funded by the county? And if you could address that in a time frame.
This is something that is a hot topic for me. I am fairly conservative, and the public health is not about clinical services. It is something that we have done, number one, because we could make money at it and keep nurses employed that we needed for potential public health emergencies. And that was probably the biggest thing. And there is the last resort. I mean, basically, if nobody else was doing it, we're responsible for making sure it gets done one way or another, and so we have done that. But I feel that there is an opportunity. The Community Cabarrus County Health Center, which you've alluded to, McGill and Logan, is an organization that does provide clinical services to the community. And I would like to see us transition out of the clinical services, and I feel there is an opportunity to move some of these programs into that program. Now, we're currently working with them to ensure their viability, so we would have a partner that we could work with. It's not entirely clear that that's going to work out, but I would very much like to see that. It is something that I have wanted to see for a number of years, and I feel we have an opportunity at this point, and it's something we are actively working toward.
And we have made some progress in the last year. You probably noticed from last year's budget to this year's budget, we halved your contribution to clinical services. So it's down to 170?
114.
114 from 300 and something last year. So the idea would be to decrease that even more this year, hoping to get to zero. And as Mr. Phillips said, it makes so much sense because it's another one of those quirks of our healthcare system. They get paid more to take care of a patient than we do. So when they get paid more to take care of them, why would we not want them to take care of them and get the higher reimbursement rate? And so it's a win-win for everybody in the community if we can transition those services over.
Do you think it's a realistic transition over the next 2 years?
We would have thought it would have been a realistic transition with 1 year, but their finances are such that they are struggling to stay afloat. Literally, we have, as most of you know, come in and rescued them this year. Pam even has been down there helping out. I mean, their finances were in such a state of disaster that they were literally one paycheck away from being out of business. And I think we've a collective effort between the county and the Health Alliance gotten them back to the point where they can pay their bills. The next thing is to get them out walking a little bit so that they can start doing more than just being behind in their bills, which is where they are now, and actually start catching up with their bills, then actually start expanding the number of patients they see. Pediatrics is especially important to a community health center because the pediatrics is the lifeblood, and they have such a good reimbursement rate for pediatrics, but they do a very poor job of taking care of pediatric patients in terms of numbers, not in quality. And so we've got to get more pediatric patients down there, and we have lots of pediatric patients, so it'd be a great transition.
That's our largest clinical service.
Yeah.
So.
It's just a matter of moving them, but we can't move them until we know that they can actually do the job, which they, our expectation is that probably 18 months out, they'll be stable financially. But there's a couple of months right now that are a little bit tricky because they report to HRSA, the Healthcare Resource Services Administration, federal agency, part of the Department of Health and Human Services that specifies exactly what they can and cannot do. And they've been really difficult to work with us as an outside entity working with them. They want the community health centers to stand alone without any help from anyone. And what happens if they don't stand alone is that anyone else from any county can come and bid for those services who's already in that business. So that may be also what happens at a Gaston County or someone else who's doing this program already comes in at the end of the contract year 2013 and bids for this clinic. So we'd like for it to be strong enough before that happens and nobody can come in and take the agency away because it's really a critical part of, you heard Cindy and other folks talk, we've got a really tight web of care in this system, and that community health center is a key component. It takes care of all those adults which end up costing a lot of money to the healthcare system, whether it be the hospital or anyone else. They cost a lot of money. They have the asthmas, the diabetes, and other things that are not getting treated. They'd end up with amputations in the hospital for diabetes or something. So we really need to have this center strong. So that's why all of us have been working so hard to get it back to where it would be, and we really appreciate, most especially Pam's help in doing that, because she's, as you folks know, an expert in this area of finances, and I think she'll probably tell you she's probably seen nothing worse in her whole life than what she walked into there. So it's been a group effort in every way, but we do want to get to where you want us to get to and transition those services.
When I leave this meeting, I'll be going to their board meeting to try and help make sure they get into a position where we can transition clinical services under their umbrella.
Thank you.
Okay, anything else? Okay, thank you all very much.
Thank you very much.
Thank you.
Okay, next we've got Anna. Anna, you're like coming every month just about lately. It's good to, there you go. It's good to see you again. Annie on with Piedmont Behavioral Health Care, and we're glad to have you with us this afternoon.
Thank you.
To present your budget.
Okay. There were two submitted, looking at our, what the expenditures were for last year, and then looking at the current projection for this year. And PBH is not requesting any increase in the county funds that have been received in the past. Those funds are used specifically for the indigent population. We use many of those funds in the Crisis Recovery Center, which is a diversion of seeking mental health treatment in a crisis instead of going to the emergency department. That also helps to fund indigent meds, psychiatric care, as well as any services they may need, diverting those costs from the emergency department into our Crisis Recovery Center that is run by Daymark Recovery.
Okay, any questions?
How about 3 for 3? How much money is CMC giving y'all?
They're not giving us any.
Y'all certainly helped with taking the burden off of them and providing with some of these patients, isn't that correct?
We do.
Okay, and y'all provide services that they normally would provide, correct?
We do help through mobile crisis in working with the hospital and assessing care, yes.
And they give no monies or no financial assistance to PBH?
No.
Okay, thank you.
Okay, any other questions? Okay, well, that was pretty easy. It helps that you do come and present your reports.
Yes.
So that you've been on our mind the last few months, coming in and keep getting us up to date and kind of educated about PBH and everything that you do with your entity. So if there's no other questions, then we appreciate you coming by.
Thank you very much.
Thank you.
Okay, Commissioners, let's take a 10 or 15-minute break real quick, and then we'll come back for some general discussion before we recess.